I'm Victoria O'Hara, and I'm a nursing student at JMU, and today I will be asking you questions in order to gather information for your health assessment. May I have your full name and birth date, please?
Jessica Hogan, and my birth date is October 9th, 1974.
Okay, Ms. Hogan, what may I call you?
Just call me Jessie.
Okay, Jessie. Today I'm going to be spending about 10 minutes with you. The interview will be recorded. It is confidential. I will have a couple of colleagues that will be viewing it in order to help me assess information and gather data for your health physical later, okay? So I just wanted to clarify with you that it is confidential and only a couple of people will be watching it with me, okay? I'm going to be asking you a bunch of questions, so tell me, how have you been getting along?
Mostly okay, although I always have problems with my knee. It's been getting better, but I still have episodes, although I feel like I've been doing everything I can to help my knees.
Tell me, what's going on with your knees? What happened to your knee?
I was traveling a little over a year ago, and I took a step down from a steep step like this.
Oh.
And I didn't fall, but I landed really hard, and for the next 2 days my knee was a little tender and a little unsteady, but then I was taking another step down, and it was a normal size step. When I landed down, it felt like there were shards of broken glass in my knee, and I couldn't walk without crutches. I had to get crutches.
Did you seek treatment after that
Yeah,
happened?
so as soon as we got home, I made an appointment with an orthopedic surgeon, and he was able to determine from the MRI that there was nothing that could be fixed surgically. So they gave me an injection of Synvisc and then sent me to the physical therapist.
Okay, and did those things help?
I don't know that the injection did anything for me, but the physical therapy has been really beneficial. So I lost a lot of muscle tone, and so the goal has been to improve the muscle tone, but also to improve my flexibility, and there's been a lot of stretching, and that's been really helpful. In spite of that, I still have these episodes.
Wow, it sounds really painful. Tell me, what are these episodes like? You've mentioned that a couple of times, that you have these episodes. Can you explain that a little bit further for me?
Yeah, so it happens when I've been on my feet a lot, and I teach, so I'm on my feet a lot. But when I've been on my feet a lot without any breaks, I'll usually get a little twinge, and if I'm able to sit down and kind of stretch, then everything's fine, and it's even better if I can put some ice on it.
Okay, go on.
But if I don't get that rest, within a few moments, I'll get the sensation of broken glass in my knee again.
Wow, that sounds really painful.
Yeah.
Do you do anything to prevent these episodes from happening, Jessie?
Yeah, so I was released from my physical therapist several months ago, but I keep doing the exercises, so I go to the gym 3 to 5 times a week, and I do most of the exercises that I originally was doing, and that's been really beneficial.
Earlier you mentioned you were doing everything you could to help your knee, but just now you mentioned you were doing just some of those exercises?
Yeah, there were 2 exercises that were part of my original routine, and they really, really hurt. And I'm afraid that I'm actually damaging my knee and not helping my legs.
You feel like doing those exercises will make your knee worse?
Yes.
Okay, all right. Go on, carry on.
So I've kind of cut those 2 exercises out, but I do all of the others, and that's been really useful.
Okay, well I think that PT could probably show you how to do those exercises in a different way that would be less painful, maybe modify them, or even show you different exercises that could help you. You might want to think about that.
That's
because
a good
that
idea.
Might be one reason why it's not getting better the way you want it to. Is there anything else that you're doing for your knee at this time?
Yeah, one of the things I've learned is that I ice my knee as a preventative.
Okay.
So I do it when it hurts, but I also do it when it doesn't hurt. I try to do that at least once or twice a day, and that's been really useful. I've also been taking ibuprofen as a preventative. And then also I decided that I needed to get serious about losing weight, so I switched to a vegan diet.
Wow.
And I've lost maybe 40 pounds in the past year, and that I think that's been helpful too. So I started off on the vegan diet just to lose weight, but it turns out that it's helped. It's been, I think I'm doing it also as a prevention for cardiovascular
Okay, a
disease.
vegan diet. What kind of food, what kind of things do you eat on a vegan diet?
Anything that comes from a plant,
Okay.
and nothing that comes from an animal.
And you said you've lost 40 pounds over this last year?
Yeah.
Now,
yeah.
do you feel like that's helped your knee, or?
I'm assuming it has.
Okay.
I'm assuming it has. But
You mentioned that you wanted to lose weight. Do you have, is there any history of cardiovascular disease in your family?
it turns out there's a lot, and I really wasn't thinking about that at all until last year when I started on the vegan diet. And on my mother's side, there's high blood pressure and several people who've died of stroke. And on my father's side, there have been some heart attacks and strokes and congestive heart failure among aunts and cousins and uncles.
Okay, now tell me, do you have problems with high blood pressure?
Before I started on the diet, my blood pressure was on the high end of the normal scale, and now it's on the low end. So on average, it's maybe 105, 100 over 50 or 60.
And you're taking medications, or you're not taking medications?
No medication.
Okay, very good. Wow. Okay, so we've discussed your knee pain and now your weight loss, and I think that's a great strategy for prevention for the knee episodes that you're having. Is there anything else that you want to set goals for?
No, that's
Okay.
pretty much
Uh-huh.
it.
What's your goal for your knee pain?
I'd really like to be able to walk without pain.
Okay, all right. Well, Jessie, we've discussed everything here today. Do you have any questions for me?
No, thank you.
Okay, all right, thank you.